You're listening to Health Professional Radio. My name is Wayne Buckler. My guest today is Eloise Drain, founder and CEO of Family Inceptions International, and Eloise joins us from Georgia in the USA. Welcome to Health Professional Radio, Eloise.
Thank you for having me.
It's my pleasure. Now, tell us what it is that Family Inceptions does.
So Family Inceptions assists couples that are going through infertility and that are interested in working with gestational surrogates or egg donors to have a child.
I see. Now, you're not a clinician, but you provide a service in this space.
Correct. So we don't, as you said, we're not a clinician. We don't do any medical screening or testing or anything of that nature, but we are the conduit between the intended parents and the surrogates and donors. And, of course, we work with all the professionals to make sure that the process goes smoothly.
And Eloise, what's the geographical footprint of your service? You're not just restricted to the US, are you?
No. I work with intended parents as well as professionals really all over the world. And I've had many clients that have come from just about everywhere to do surrogacy in either the States or in various countries that I also work in, India, Mexico, Greece, Nepal. Unfortunately, Australia is one of the countries that does not allow for commercial surrogacy and or commercial egg donation. So even though there are infertility clinics in Australia, it's unfortunate that for many intended parents, they have to really leave the country to find the services elsewhere because it's not allowed in Australia.
Okay. Now, I see on your website you have listed fertility tourism. How does that work?
So fertility tourism is pretty much when somebody lives outside of the country by which they are going to commission surrogacy for. So that means that the intended parents might, say, for instance, come from somewhere in Australia, and they may come to the United States to commission for surrogacy or egg donation. That's what fertility tourism is.
I see. And you also say family building consultancy.
Sure. So for many people, they, quite frankly, it's where do you start? What do you do? So one of the things that we do offer is kind of just giving them a guidance of, finding out what their situation is, kind of getting a bit of a background, and then helping them determine where would be the best option for them to help them have a family.
Now, Eloise, many of our listeners are clinicians normally working in acute care, so working in hospitals, doctors, nurses, allied health professionals. What message would you like them to take away from our chat today?
Well, for many, when they have patients that come in and might have issues with infertility, it is different in all parts of the country. But for many, people don't realize that infertility is a disease. It is not. It's not just as simple as they can't have children, no big deal. Infertility really is truly a disease, and for the majority of people that commission for surrogacy and or even egg donation, they have a medical issue, and so they. For many of the health professionals, the biggest thing for them as well is, I have this patient that has these issues, but I don't know how to help them. I don't know where to go to assist them or what information I need to provide, and so that is what we're here for. We kind of can guide whomever, regardless of whether it's a professional or intended parents, and kind of give them some knowledge of what they need to either provide to the patient so that the patient can move forward with whatever they're doing, or, of course, speak to the patients themselves.
Now, am I correct in assuming that there's no need for a formal referral to you, that people can contact you and self-refer to your service?
Correct. That's absolutely correct. Mm-hmm.
Is the website the best way for people to get in touch with you, Eloise?
It is.
And that's www.familyinceptions.com.
Correct.
You're listening to Health Professional Radio. My name is Wayne Buckler, and I'm in conversation with Eloise Drain, the founder and CEO of Family Inceptions International in Georgia in the US, but also an organisation that has a global footprint. And we just mentioned the website, so I'll mention it again. It's www.familyinceptions.com. Now, Eloise, my favourite question in every interview I do, in every industry there are misconceptions. There are patients and clients and customers who have a misconception about your industry. What's the biggest misconception that drives you nuts and keeps you awake at night?
Oh, gosh, there's many. First being that, as I mentioned before, infertility is a disease.
Yes.
And I think once people start realizing that, they will look at things differently. Second, for women that choose to become surrogate and or even egg donors, a lot of people feel that they're being exploited. That is not the case. I have been personally myself a gestational surrogate 3 times. I've delivered twins and 2 sets of singletons. And I've also been an egg donor as well. I am an educated woman, and I did it out of choice. I felt that it was something that I was supposed to do, and I wanted to give back and help somebody. And so for many surrogates, it's the same thing. They choose to be surrogates, not because, they see a dollar sign, because quite frankly, being pregnant for 9 months and carrying somebody else's child and going through everything that you have to go through pregnancy, there's really no amount of money that would be sufficient. And it is not where surrogates are being exploited. Now, there are some countries where some, surrogates are not treated very well. However, there are a lot of clinics that do exceptional work, even in those countries, and they take very well care of their surrogates as well as egg donors.
I see. Thank you, Eloise. With a little bit of luck, we'll be able to dispel some of those misconceptions as a result of having this chat with you now. If you've just joined us, I've been in conversation with Eloise Drain, founder and CEO of Family Inceptions International from Georgia in the US. The website is www.familyinceptions.com. And Family Inceptions is an organisation that offers third-party reproductive services, including egg donation, gestational surrogacy, fertility tourism, and family building consultancy. If this is a topic of interest to you, there's no need for a formal referral process. You can head straight off to the website at www.familyinceptions.com. If you've missed our conversation, the good news is we have a transcript of this interview on our website at www.hpr.fm, and you can also listen to the audio archive on our website and on YouTube. Eloise, thank you for being with us tonight. It's been a pleasure talking to you.
Well, thank you so much. I appreciate it.
This is Wayne Buckler for Health Professional Radio.